let's start with the Centric Health sponsored hour. Dr. Bridge Bombi comes on every week to answer our questions about the coronavirus. Dr. Bombi, welcome, sir. How are you?
I'm well, Richard. How are you?
I'm doing terrific. Thank you so much. Dr. Bombi, I keep hearing that this weekend is going to be so important in this nation's fight against the coronavirus in terms of, here we go again, another holiday weekend. Normally on this weekend, families gather. There are picnics. You get 40, 50, 60 people at a go. You got a lot of steam that's got to be let off in this country. People are housebound. They need to get out, and yet it's probably more important than ever for us to stay in. Let's talk about the importance of this weekend.
So, Richard, I'm hoping that the third time is a charm. We did that on the Memorial Day weekend. We did that on July 4th weekend. I hope we don't repeat the same mistakes with the same consequences. So as far as the inside and outside is concerned, outside obviously is much better because it limits the degree of spread, it dilutes the dose of the virus. But the same safety measures, which everybody understands, everybody knows now, have to be adhered to during these 3-4 days to make sure we don't have bunch of clusters all over the country and again overwhelm the healthcare system. The surges can be preempted through our behavior-based mitigation of spread. Mm-hmm. And that message needs to be reinforced on a recurrent basis. It's within our hands, within our efforts to prevent that from happening.
And what is the best way for us to behave this weekend? Is that to really cloister ourselves away with just our immediate family? I mean, should we be doing anything different, or just hyper aware that we're not doing anything that smacks of what normalcy used to look like?
So the crowd control, first of all, is the number of people who are in a group should be small, limited to 10 people or so. Secondly, the parties should be on outside, not on the inside, because when inside, all the reasons of HVAC and air and close proximity, the fact that people may have a drink or two and then they become loud, and then the aerosols and the droplets spread farther, the dose of infection increases. So maintaining a distance, keeping it outdoors, limiting the size of the crowd, and in close proximity of less than 6 feet, make sure the masks are worn properly. The nose has to be covered, the mouth has to be covered, the mask should extend to the underneath of the underneath of the face, and it should fit tightly. So those are measures that have shown efficacy on a consistent basis.
Yeah, I mean, it's simple stuff. We just have to adhere for it. But here we are 5-6 months into this, and boy, there's some people just itching to get out. You know, there's a lot of talk about this vaccine. The vaccine is the hot topic, and I was sharing with the listeners of this show earlier. I had a conversation with my wife last night, and we were watching one of the evening news programs, and they were talking about the vaccine. And the questions about the vaccine are, there seems to be some people are doubting whether, for political reasons, are we rushing this vaccine? They mention, one of the vaccines, it may be 2 doses, and does that show that we're rushing this thing because you don't like vaccines with 2 doses because some people won't get that second dose? So I turned to my wife and I said, honey, you wouldn't have any problem with this vaccine, would you? And she looked at me, she goes, I don't know. Now, it is astounding to me that we have reached a point in this country where there's so little trust and credibility in the process and the scientific process, or maybe it's just been intermingled with the political so much that people are wary that here we're under this pandemic. And yet, and you've said it, Dr. Bombi, you said it a couple times here on the show, that up to 50% of American adults have expressed some hesitancy about the vaccine. Can you talk to me about the process? And as Americans, as we rush to forward to this vaccine, should we be having full confidence in the process?
It's important to retrace the path of the virus and our knowledge about it. When the corona or the COVID-19 pandemic started, we had legitimate concerns about the stability of its genetic material. So fortunately, the genetic material in COVID-19 is twice the size of influenza. So it comes in with proofreading material. So the virus replicates itself on a pretty consistent basis. So there's less of mutation. And that stability is extremely important in being able to create a vaccine. So if the virus keeps on having a chameleon behavior and has antigen drift or mutations, the vaccine that's made Monday may not be effective on Thursday. Fortunately, the genetic stability is on our side. And the second most important thing that has happened is we questioned, would it lend any durability in immunity? Would there be immunity? And secondly, would there be durability in immunity? And both those questions have been answered affirmatively, because so far there are very few isolated cases of double infections or reinfections over a 6-month period. So safely assume the immunity is good enough for at least 6 months, and we'll see how far it lasts, because the clock is still on. I'll give you an example of a trawler, a fishing trawler in Seattle. 117 people went to the sea for fishing for several days. 3 of the officials on the boat had infection before, documented by antibodies. So out of the 117, 103 got infected. The 3 people who had the antibodies didn't get infected. So that's very strong proof that virus lends durable immunity. So check the box. 1, the mutations, not that much. 2, the immunity, yes. 3, the science now. The science has been pretty sound, and the technology pioneering and innovative. So we have taken the platforms that previously didn't exist, which is genetic basis or even protein-based, even now particle-based vaccines. All these sciences, all these vaccines have demonstrated in phase 1 and phase 2 in a very responsible and well-audited manner. Yes, there is an immune response, and immune response is robust, and the side effects are minimum. So we have met the accelerated timeline in a clockwise precision manner. Now, as far as the third phase, we'll talk about that in a little bit, but as far as having political contamination of the scientific material, I tell you there are significant barriers to that. All the data that comes from these trials is not reviewed by the people who are conducting the science. It's an independent board who does that. And over and above, there are people, the infectious disease doctors and other epidemiologists, are demanding greater transparency, and that only be prudent if the data is shared with epidemiologists and infectious disease doctors that further reinforce in a transparent manner the authenticity of the data. So I'm pretty sure the political pressures exist, and to a degree the political pressure is necessary and even desirable, because when you're in the middle of the pandemic, the most important thing, I don't care about the elections, but the most important thing is saving lives. If you have one or other incentive to push to a successful outcome, I'm all for it. But the concern that you express and other people shared is, would we have a vaccine that's vaccine in name only and doesn't have the efficacy or safety? My suspicion is the team of scientists and the independent auditors who are looking at the data have the burden of history. I don't think in their right mind, they'll make a decision that's bad for the humanity, because that will really put them in lasting infamy
Yeah.
in the book of human history.
Yeah. Well, so that's good news, though. If you say that so far what you've seen as the potential vaccines have shown durability and fewer side effects, that sounds to me as good as we could hope for at this point. Is that right?
It exceeds the hopes, actually. It exceeds the hopes because, again, we have the concerns about the possibility of being able to get a vaccine for that. Remember, we don't have the vaccine for Hep C, we don't have the vaccine for HIV, we don't have the vaccine for the coronavirus. So we were on that slippery road. What if we don't have the vaccine? That is extremely optimistic that we cross those hurdles in a very effective manner.
Yeah. What does it mean when there was a medical expert talking on the news last night, and she said she didn't like that? I think the Pfizer vaccine they were talking about, that you'd have to go back twice. You'd need 2 injections or 2. You'd have to do it twice over 6 months. And as I recall, that was what was required for a shingles vaccine. I believe I think you had to have 2 shots or whatever. Is that unusual, or is that less desirable, that having to require people to come back for a second one, not knowing if they are?
It is a dosing protocol. So, of course, it's less desirable. Ideally, the first shot should work. But it is what it is, because in Moderna messenger RNA virus, the second shot is necessary 2 weeks after the first dose. That's just how the booster mechanism works. It's called anamnestic reaction in our part of the world. But it's a booster dose that further accelerates the immune response. So the 2 dosages are necessary, the same way as you mentioned about the shingles virus, shingles vaccine, that 2 dosages are necessary over a period of 60 days. It's just the nature of the regimen. It doesn't speak against the efficacy or the speed of development. It's just the nature of the vaccine for this disease using that particular technology.
Great, right. As we wait on this vaccine, I know there's still been a lot of experimentation on existing pharmaceuticals. Of course, we heard a lot about the hydrochloroxide and that type of thing. But have there been other uses of existing pharmaceuticals to thwart or to dull the virus that have been shown effective?
Yes, I want to come back to the phase 3 also, but the other pharmaceuticals that have been tested, there are a few antivirals that didn't work, but the one that works is the commonly used steroid, dexamethasone and prednisone, which are cheap and very effective in a segment of the people who have infection that's serious, that requires hospitalization and causes hypoxemia or lack of oxygen and or requirement for intubation. So in sicker population, the steroids make a substantial difference, about 30% reduction in mortality. It's not recommended for every infection, only the infections that cause drop in the oxygen saturation in the blood.
Huh. Are those steroids you mentioned?
Yeah, those are the steroids.
The steroids, that's what I thought. All right, go back to phase 3, what we were talking about.
So, let me just quickly mention about because you mentioned about the pharmaceuticals.
Right.
The other thing is convalescent plasma.
Ah.
Convalescent has also created a bit of a controversy. The history of convalescent plasma goes back to 1890 when it was first developed for diphtheria. It's also called golden liquid because its color it's a yellow color. It's plasma which is centrifuged out of the blood that carries the antibodies. So at Mayo Clinic, they tested it under emergency use authorization in about 70,000 people. In 70,000 people, in a segment of the patients who were under the age of 80, early in the infection phase, and not too sick, when they received convalescent plasma rich with antibodies, there was a 35% reduction. So there are multiple caveats.
Okay, got it. Yeah.
Rich with antibodies.
Right.
under the age of 80, not requiring intubation. So that segment had benefits. So convalescent plasma has its utility in a certain segment of the people with infection.
Okay, or not with everybody, but with a certain segment, it's effective. And I know there's been a push to gather that. Okay, you want to go back to phase 3 of the
Yes.
and phase 3, which you said that the Russian vaccine did not even have, correct? Yeah.
That's right. That's right. So they just published, by the way, in Lancet this morning that they had trial. Look at the number: 76 people. 76 people. Phase 1 and phase 2, and based on that, they're universalizing the use. So it's a little audacious on their part, but hopefully not too dangerous.
76 people?
That's it.
That is it?
That is it.
Okay, there you go. All right.
So let me just walk you through the phase 3. Let's look at the Moderna. Moderna people have 30,000 people. They're trying to recruit 30,000 people, 15,000 in each arm. 15,000 will get the vaccine, 15 will get the placebo. Then they go back to their regular lives, and they're exposed to the element. And some will get infection, some won't, most won't. So in Bakersfield, if I have to extrapolate our current numbers, if I have to have 30,000 people exposed simultaneously for a month, 30 days, to the virus, the most I can expect is 600 infections, most. So which would mean 300 in each arm. But to recruit 15,000 people in each arm that are reflective of the population, that includes the minorities and sicker people, it takes a while. And you don't have 15,000 people on day one. And then the follow-up issues and other things. So the recruitment is a bottlenecking. Then the fact that it has to be given twice over a 2-week period, that's another step that adds a timeline to the vaccine. But at the end of the day, you have to have infection in the population. If the infection rate drops, then not enough people are infected. You will never achieve a statistical significance either way. So you achieve a statistical significance. So let's say if you walk through the example of 2%. So if you have 300 people in either arm that potentially got the infection, and let's say the virus, the vaccine is effective 60% of the times. So in the people who have placebo, you will have 300 infections. In the arm where people got vaccine, you will have 60% less infection, which means that only 120 people will have infection.
Okay.
Because vaccine prevented infection in 60% of the people. Mm-hmm. So that will give you a statistical value, which is significant, and you know that you have a vaccine that works. But on the other hand, if the vaccine is effective in 90 or 100% of the people, you won't even need to carry the trials to completion because you will abort the trial because then it becomes an ethical dilemma how to deny an effective vaccine to the population.
Huh.
The flip side is if it's less than 60%, less than 50%, it's ineffective. So that's where it's necessary to have two arms. You look for the disparity. That's a favorable disparity. That's statistically proven benefit. Then you universalize it.
Ah, that's so interesting. How long do these studies take? Because it seems to me, I mean, they call it Project Warp Speed. It just seems like it's moving very, very quickly with little room for error. How long does a typical phase 2 take, or does that depend on how many people you have in the study?
The phase 3 is the one where the timeline is somewhat out of control because it's open to the elements. You have to recruit representative people, representative samples, and then they have to walk through. And then you have to get the infection. You have to have a right number of, substantial number of people who are infected for statistical value to be arrived, for the vaccine to be called successful and effective. So that's where the lines get blurred, and that's the phase we are in now. So when people say you could have vaccine by November, that's a theoretical possibility, but it's difficult target. You never can say no, but that's a difficult target. It's a January, February, much more realistic timeline.
All right, we're about out of time. I want to end it by asking you the same question I asked my wife last night. Would you have any reluctance to take whatever vaccine that emerges as our choice, and would you recommend it for your family?
Absolutely so. As I told you before, first I would like to do is I'd like to have all our political class, our president, Congress, Senate, everybody with their family should take the vaccine to make an example that they're not selling anything less than perfect.
That's a good point.
I will have to answer your question.
Okay, very good. All right, we're out of time. Dr. Bridgebomby, thank you, sir. I want you to have a safe weekend. We're all going to practice what we're preaching here, try to get through this weekend. We're not going to make it another Memorial Day. We're not going to make it another July 4th. We're going to do it right this time. Bridgebomby, everybody. Thank you, doctor. I appreciate it.
Thank you, Richard.
News